Hello and welcome back. And when you see me here, you know it's Matters Health. And today I want us to look at one of the um, topics that we've discussed before. So today I want us to look at danger signs postpartum or danger signs after delivery. So what are some of the things that you need to be aware about after delivery, so that your health, also the health of the mother and the health of the baby are taken care of. But before we start, I want us to start with or to listen to some words of wisdom from the book of Isaiah, chapter number 60, from verse 1. The Bible says, "Arise and shine, for the light has come, and the glory of the Lord has risen upon you. For behold, darkness shall cover the earth, and thick darkness the people, but the Lord will rise upon you, and his glory will be seen upon you." So let's dive into it. And if you're new here, please consider subscribing to our YouTube channel, Doctor on Wheels. But also you can also follow us in our social media platform, that is our Premier Hospital _ Ngong for our Instagram, and Zawadi Premier Hospital Ngong for our Facebook page. So let's dive into it. So what are some of the danger signs that you need to be aware postpartum or post-delivery? So number one is excessive or heavy vaginal bleeding. Now, after delivery, there will be some minimal bleeding, what we call lochia. So how it is that before the first 4 days, it will be a little bit bright red, okay, or dark red, and then from the 4th day to around the 10th day, it will be a little bit pinkish or brownish, and then from the 10th day all the way to around 4 to 6 weeks, it will be yellowish and coming to somehow whitish. But then number one is supposed to be reducing in amount. So that is the normal, okay, the normal process. But here you realize that with heavy bleeding, it means then you actually change more than one pad per hour. And that is either after delivery, okay, or sometimes it might have stopped and then you are okay, and then all of a sudden the bleeding started. Now, with that is basically postpartum hemorrhage. Now, postpartum hemorrhage can be primary, and this is where the bleeding starts within the first 24 hours after delivery, but it also can start past 24 hours after delivery, what we call secondary postpartum hemorrhage. Now, what could be the cause of postpartum hemorrhage? So, especially for the first 24 hours, there are 4 things that have been attributed to postpartum hemorrhage. So, number one is either if you have had a tear, and the tear can be all the way from the cervix, or cervical tear, or around the birth canal all the way to the perineum, so what we call perineal tear. Number 2 is that you could have a problem with clotting. So you have what we call coagulopathy. So your blood is not able to clot normally. You don't have enough clotting factor, so then the blood does not clot normally. Number 3 is sometimes you either have something that has been retained in the uterus, like a retained placenta or some membrane. So basically, if they don't completely detach from the wall of the uterus might not be able to contract well, and therefore you will end up with some bleeding. Or if the uterus just fails to contract, probably you ended up not producing enough oxytocin to help with contraction of the uterus. But also the contraction of the uterus sometimes might not be very consistent, especially when you have had twin pregnancy or multiple pregnancy. So with multiple pregnancy, what happens is, the uterus was so big, so contraction might not be as fast as normal when someone just had one baby in the womb. So multiple pregnancy can actually make the contraction of the uterus not so much consistent, and therefore it can actually predispose someone to postpartum hemorrhage. So you need to be aware about excessive post-delivery bleeding. okay? Because with that, when the bleeding is too much, it can cause hypovolemic shock, and hypovolemic shock, it's very, very, it's a medical emergency, and it can actually cause death. So you need to be aware about that. Once the bleeding starts, please rush to the hospital for attention and for evaluation. Number two is you need to be aware of signs of infection. Now, signs of infection can range from high fevers, from probably fevers of 38, chills, okay? Or you can have false smelling vaginal discharge, false smelling vaginal discharge. So we talked about the lochia. The lochia is supposed not to be very smelly, but this one will be false smelling, okay? Now, for someone who probably underwent a cesarean section, you might have some discharge from the wound, or from where there was the wound for the cesarean section is. So basically discharge, okay, from there, which is yes, any type of discharge, okay, can be a sign of an infection. So anytime you have a discharge, which is false smelling, or when you start passing urine with pain, okay, or there is some swelling around the breast, okay, or there is a lot of pain when you start to breastfeed. There's some minimal pain which probably is accepted when you're breastfeeding, but when there is severe pain when you breastfeed, it could mean that either the ducts that are bringing the milk could have been blocked, what we call breast engorgement. But also, you can get an infection of the breast called mastitis, or breast abscess, whereby the breast will be swollen, okay, it will be red, and it will be painful on touch, okay. So it can also be associated with high temperatures, okay. So those are some of the danger signs that you need to be aware, because with that you will have to be given some antibiotics, okay. So you need to be evaluated. So don't wait at home, please go to the hospital, get evaluated, so that we are able to know exactly what is happening, so that you can receive the right attention. Number three danger sign that you need to be aware about is severe abdominal pain. So, especially if you have undergone cesarean section, the pain is supposed to be manageable, okay? Especially after taking some painkillers, the pain should be able to disappear, and you should be able to do the normal things here and there. But this kind of pain is so severe in such a way that even if you take some painkillers, you basically cannot get it suppressed. And most of the time, it could be, you might be having what we call a hematoma. Okay, so hematoma is basically just accumulation of some blood, especially for patients who have undergone cesarean section. Okay, they are prone to hematomas. So can have hematoma, and if this hematoma gets infected, you end up with a pelvic abscess. So infections also, you can get infection of the inner lining of the uterus, what we call endometritis, okay. But also for patients who have undergone cesarean section, because we ended up cutting through and to get out the baby out, okay. The effects of anesthesia and the fact that we opened the abdomen and we either touched the intestines, the intestines can actually go into what we call paralysis. Okay, now most of the time after delivery or after the cesarean section, bowel movements are supposed to be coming back probably within 4 to 6 hours. Okay, so that's why you advise that after 6 hours you can start eating. But then something can happen and you don't get back the bowel movements as expected, and that can actually cause what we call intestinal obstruction. But also in the process of extracting that baby through cesarean section, there might be some injuries to the bowel, okay, or some injuries to the bladder, or some injuries to any other organ, okay, and that can actually cause, like for example, injuries to the bowel. It can cause intestinal obstruction. Okay, so and that one can cause severe abdominal pain. So you need to be aware about severe abdominal pain. Please don't wait at home. Just go to the hospital, get evaluated. If it's something that is able to be managed and you have been assessed and there is no any of these danger signs, you will be advised and you will be released back home. Okay. The fourth danger sign you need to be aware about is painful, swollen, and red leg or legs. Okay, so that one might be the only sign that you might be having blockage of your veins in your in your legs, and that one can be a sign of deep venous thrombosis. And that can also be associated with shortness of breath, okay, difficulty in breathing, especially when you throw that emboli. So we say that the clot can move from the leg, okay, it can go to the heart, and then the heart pumps that clot to the lungs, and if it's pumped to the lungs and it blocks the lungs, okay, you will end up with something called pulmonary thromboembolism, and that is a medical emergency, because with that it can actually lead to a loss of life. So anytime you have shortness of breath, first of all, if you have swollen legs, okay, that are red and painful, do not even wait at home. You need to get evaluated so that we rule out deep venous thrombosis, and if it's just the normal swelling post-delivery, then you will be advised on what to do. Now, shortness of breath can also be caused by, especially for people who after delivery, they basically don't want to walk, or they just want to lay in bed and just rest for quite some time, more than 1 or 2 weeks. You can actually get an infection of the lungs called what we call hypostatic pneumonia. Now, hypostatic pneumonia is because you're just static, you're not moving, you're always in bed, and basically you can actually get that infection. And last but not least, shortness of breath can also be a sign of whereby, especially if you have had issues during pregnancy where you've had either eclampsia or preeclampsia, you've had anemia, persistent anemia, and you ended up having heart failure. Okay, so after delivery, that all that fluid that all that around 25% of your blood was sent to the placenta. Once we remove that placenta after delivery, that 25% of the blood that was being sent to the placenta comes back to your system. And when it comes back to your system, it means that it can overwhelm the heart and you can actually run into a heart failure, especially if you have had issues before. So that one can cause what we call pulmonary edema, okay? Because now fluid can accumulate in your lungs and that can cause pulmonary edema, and therefore you need to be evaluated. So shortness of breath, okay? Please don't wait, okay? You need to be able to be evaluated. The fifth danger sign that you need to be aware about is severe headache, blurring of vision, convulsions, and I will also add here fatigue and some dizziness. Okay, so basically general body weakness, feeling tired, convulsions, headache, blurring of vision. Those might be signs of, number one, if after delivery you might have bled a lot and therefore you end up becoming anemic, and that one might be the only sign that you might be having for anemia. Okay. So number two as well, you can have late onset of what we call preeclampsia or hypertensive diseases post-delivery. And we have alluded earlier, you have around 25% of the blood that was sent to the placenta, okay? And now here you end up with that blood coming back to the system, okay? Now, if you bring back that blood back to the system, it means then it can overwhelm as well the heart, and basically you can end up with heart failure, okay? And that can actually cause our preeclampsia basically, and that one can cause the headache, blurring of vision, and all that. And those might be as well, and with that, you can actually run a risk of either stroke, okay? Yes, so you need to be aware about that. Now, this is very rare, but there is nothing that cannot happen, okay? It's very rare, okay? I probably have never for my experience, I've not had any patient who comes back with this kind of infection post-delivery, but it's possible. Now, for patients who undergo cesarean section, and you are given that injection at the back, okay, to be able to numb the lower side of your body to get that baby out. Now, the process where the needle is introduced to your the the spine, okay. They can also introduce, if someone basically does not do its sterile procedure is not performed, you can introduce infection through that, and you can actually, that one can lead to meningitis. And now with meningitis, you can still have this headache, blurring of vision, dizziness, okay, yes, and all that. So you need to be aware about that, especially post delivery, especially post cesarean section. Now, the other thing that you need to be aware about is we have already alluded to that, breast engorgement, which comes with pain around the breast and swelling and redness. And then sometimes, especially post cesarean section, if you end up with difficulty in passing urine or inability to pass urine completely, that might be pointing towards either an injury that could have happened during the process of delivery. Okay, so you need to be aware about that. So then you don't just wait, you need to get the right attention. Last but not least, the last danger sign that you need to be aware about is persistent sadness and the feeling of wanting to harm yourself. Okay, so that one might be like the feeling of worthlessness, feeling of not feeling worth. Okay, you want to harm yourself, you're always sad, you're always moody post delivery. That one might be a sign of what we call postpartum depression or postpartum psychosis. Now that is bad, okay, because you can either harm yourself, and we have had stories where people basically go ahead and harm their babies and actually kill their own babies. So every time you start feeling sad about yourself, sad about your situation, sad about anything that is going around you, okay, please seek medical attention as soon as possible before you either harm yourself or you harm that little bundle of joy that God has blessed you with. Now, by far, those are the major danger signs that you need to be aware about. Now, if you're new here, please consider subscribing to our YouTube channel, Doctor on Wheels, and you can also follow us on our social media platforms. Now, if you have any question, you have any contribution, you have any concern, please don't hesitate to comment and I will take time to be able to go through your comments and be able to respond to them effectively. Now, you can also visit us at our hospital. We are located at Loopsil Center. That is Zawadi Premier Hospital, Langong. We are located at Loopsil Center, that is opposite Jonko Petrol Station, and ground floor. And you can also and I'm sure you will be able to meet very wonderful staffs who will be able to attend to you well, and you should be okay. Now, until next time, thank you so much for your feedback and thank you so much for your support. Until next time, God bless you.